You're still live with us on News Central now. Many thanks for staying tuned. Let's leave the shores of Nigeria for a bit and head to Zimbabwe, where we understand that given the epidemic in the country, South Africa and other surrounding nations are boosting efforts to combat cholera. Now, Zimbabwe has declared a state of emergency, and over 250 people died from probable cholera last year. The number of people killed climbed dramatically during the holiday season. Meanwhile, South Africa's health service is concerned that the disease will spread across the border as Zimbabweans return to their homes in South Africa. And now to have this conversation, I'm joined by the National Spokesperson, Department of Health, Foster Mahali. Thank you so much, Foster, for joining us.
Good evening to you and good evening to your viewers, and thanks for this opportunity and Happy New Year.
All right, Happy New Year to you as well. Now, Foster, how dire would you say that the cholera situation in the neighboring Zimbabwe is, and has there been any cross-border contamination so far?
Definitely, as the Department of Health in South Africa, we are very concerned about the situation with regards to cholera outbreak at the neighboring country, like especially the Zimbabwe, precisely because of the number of cases and fatalities, because we always say one death is too many, one case is too many, as we know that the diseases have got no boundaries. They can spread because of cross-border movements between two countries. So we are very concerned precisely because we just came out of a cholera outbreak in South Africa, where we battled the cholera and we lost a number of people because of cholera in the country. So we don't want to go back to where we come from, because we have got experience. We know how frustrating it is and the impact of the outbreak of diseases like cholera on the health system and on the lives of our people. So we're very concerned, and we had to send out a communication to all those who will be traveling from Zimbabwe, especially in the areas where there's an outbreak of cholera, to say, please try to be vigilant of cholera signs and symptoms, as we've intensified health screening at the ports of entries, especially on the border between South Africa and Zimbabwe, in order to ensure that we're able to manage and mitigate the cross-border transmission of this disease.
Right. Now, we also do understand that vacations are now rounding off, and Zimbabweans living in South Africa will be returning to South Africa. What precautionary measures have been put in place by South Africa and the government to manage any cross-border contamination that might, threaten the people?
Definitely, you're correct that there's a lot of Zimbabwean nationals who are staying, working, and doing business in South Africa. Others, they just come here for other economic reasons to stock food and all those things. So, hence, we had to intensify the screening and health education at the ports of entry, especially the ports of entry, working together with other public entities like Border Management Agency and other stakeholders, in order to ensure that all people who are coming from those cholera endemic areas, they get screened for cholera. And anyone with the suspected cholera case or positive, we refer them to the nearest hospital for further management in terms of testing, in order to ensure that we are able to not only to prevent the spread of cholera into the country, but also assist the patients themselves. As you know that the cholera, one can lose life because of cholera. Hence, we are appealing to all people to say, please try to cooperate with our health officials at the screening points to ensure that we're able to assist you and also assist the other citizens. So we say try to be as transparent as possible, although we understand that the signs, one can get infected with cholera, the signs and symptoms might appear after 12 hours to 5 days. So we say anyone with suspected case, signs and symptoms of cholera, please try to be transparent, inform our health officials, and no one will be denied access into the country precisely because of suspected cholera signs and symptoms.
Right. Now, it also looks as though the cholera outbreaks in the southern African countries of late have been escalating. In your own thoughts, what should be done to manage these outbreaks, not just in South Africa now, but in other countries? And what has South Africa specifically done in terms of trying to contain the outbreak following what Hammanskraal witnessed last year?
Definitely, the outbreak of a disease should not become the sole responsibility of government or the Department of Health, but it should be the collective responsibility, because there are many other sectors of the society which play a key role in order to control the spread or the transmission of the disease. Hence, we have to intensify hygiene, because hygiene is one of the most effective preventative and control measures in order to prevent the further spread of cholera. Hence, we have to work with different stakeholders, including the World Health Organization, the country, the local office, but also the continental and the SADC office, in order to ensure that we work together, working together with other sectors of the society, the other government departments, in order to ensure that we heighten our awareness campaign as far as hygiene is concerned, because as you know that the cholera can transmit fast through contaminated food and water. Hence, we always encourage people to say, please don't drink water which you just fetch it from the river, open well, without treating it with some either boiled water or put some 1 or 2 spoons of jig. But also try to ensure that wash your hands before you eat food, wash your hands after using the bathroom, wash your hands before you dish or you cook food, and ensure that all the people that are eating in one space, in one plate, one pot, let them try to wash their hands in order to mitigate or prevent any possible transmission of cholera. As you know that the cholera is a bacterial disease, so we can be able to, that's how we manage to control further spread of cholera at Hamaskral and other parts of the country. As you know that even other parts of the country, we experience the outbreak of cholera. So we can be able to assist the people who are coming from Zimbabwe, and also we work together with the Zimbabwean health officials, just like other health officials in other countries, Mozambique, as part of SADC, in order to ensure that we cannot fold our arms when one country is facing a public health challenge.
All right, Foster Mohali, National Spokesperson, Department of Health, Gauteng, South Africa. Thank you so much for joining us to discuss this.
Thanks very much for this opportunity.